Hi, everybody. I am Susan Cohen, and I'm a physical therapist. I specialize in orthopedic recovery. So if you're watching this video, it is most likely that you are scheduled for a total knee replacement. Right now, you might be having a lot of emotions. Part of it is excitement because you're finally addressing your knee pain, but the other side might be a little bit of anxious because you're not really sure what to expect as far as surgery and the recovery ahead. Here is the good news. You have an incredible opportunity right now. The next 8 weeks prior to your surgery is your time to set yourself up so that you have the fastest, smoothest recovery. Today, I'm going to walk you through a comprehensive prehab program to strengthen your knee, maximize your range of motion, and get you set up for the best outcome for surgery. By the end of this video, you will have a complete exercise routine and a checklist that you can work on to prep yourself for your upcoming surgery. Before we dive in, a quick disclaimer. I am a physical therapist, but I'm not your physical therapist. Remember that this video is for educational purposes only and is not medical advice. Before you start any exercise program, you want to check with your surgeon and your physical therapist. And remember, if you have any severe pain or swelling or fever, something that just doesn't feel right, make sure you stop and you consult your healthcare provider. All right, let's get started. You might be wondering why exercise a knee that's going to have a replacement anyway, and that is a great question. I can tell you, research shows that people who do prehab have much better results after surgery. They have improved strength quicker, they have a return to walking quicker, they have less pain, they have a lower risk of complications, and they have better outcomes 6 months post and further after surgery. So think of it this way. If you were going to run a marathon, would you just go to the marathon? No, you would have to train for it. So think of your surgery as getting ready to run a marathon. We want to maximize the strength of your quadriceps, your hamstring, your hip muscles, because they are going to be doing the heavy lifting after surgery. Additionally, it gets you in the mindset and the habit so that once surgery is over, you will hit the ground running. Well, at least walking. Let me show you really quickly what your knee anatomy looks like and what surgery will involve. So your knee is made up of 3 bones. You have your femur or your thigh bone, which is up here. You have your tibia or your shin bone down here. And then you have your patella, which is the small bone that lies in front of your knee joint and it's in your patella tendon. So you also have some cartilage, which is cushion section in the middle of both bones, and it acts as a shock absorber. What happens over time is just from wear and tear, use, the cartilage wears down. And over time, you have bone rubbing on bone, and that's what causes your knee pain. During knee replacement surgery, the surgeon is going to remove the damaged parts of your femur and your tibia. So they will cut those areas away and they will be replaced with metal and plastic components. So the femur is going to have a metal cap, the tibia will have a metal tray, and then the cartilage is replaced with a plastic component. Sometimes also your patella will be resurfaced. So what's not being replaced? All the muscles around your knee, your quadriceps, your hamstring, your lateral knee stabilizers that are coming from your hips. This is what's going to help control your knee motion after surgery, and your body will be relying on these muscles. That's why it is essential to strengthen them prior to surgery. Before we start exercising, I'd like you to record some baseline measurements. This will help track your progress as well as be good information for your doctor. The first one we're going to look at is your range of motion. Let's look at your extension and your flexion. Next, you're going to do a functional strength test. So the first thing, get up from a chair. Can you get up without using your hands? Or if you do use your hands, how much help do you need? Write it down. Next, can you stand on one leg, the one you're going to have surgery on, for 30 seconds? If not, mark down how long you can maintain your balance. And the last one, take a 6-minute walk and write down how far you went. Was it 1 block, 2 blocks, or if you have a Fitbit or a other device, you can measure how many steps you took in the 6 minutes. But let's get that written down. Range of motion and your strength. And the last bit of recording that you're going to do is your pain level. So on a scale of 0 to 10, where 0 is no pain and 10 is the worst pain you could imagine, you're going to walk and assess your pain level. How much does it hurt? What about when you're sitting? How much does it hurt? And what about doing stairs, up versus down? Mark those numbers down on a scale of 0 to 10. This is your beginning record, your range of motion, your strength, and your pain. All right, now we're going to get into the main event, your prehab exercises. You're going to do these 1 to 2 times a day, anywhere between 10 and 15 repetitions each. I know it's a commitment, but remember, this is your investment in your recovery. You will be so thankful that you were committed. So let's get started with the most important muscle, your quadricep. The exercise is a quad set. It seems relatively easy. However, your quadriceps tend to shut down sometimes after surgery due to pain or swelling. So we want to teach that quadricep now and let it remember this is what you need to do. For your quad set, you're going to either sit on the floor or you can sit on a chair with your leg propped up on a chair. And you're going to push the back of your knee down as if you're trying to push it into the floor. You should see your kneecap move up and your thigh is going to tighten. You're going to hold 5, 4, 3, 2, 1, and then let it relax 10 to 15 times. Now, if 2 times a day seems easy, you can add a 3rd set throughout your day. Exercise 2 is a straight leg raise. You're going to be in the same position. However, now I'm going to lay back. I'm going to tighten my knee like I did for the quad sets. And now I'm going to lift my leg up about 12 inches or level with the opposite knee and then back down, slow and controlled. 10 to 15 repetitions. Now, if this seems easy, then you can add an ankle weight anywhere from 1 to 3 pounds. If you're doing this and you're unable to get your knees straight, then you're going to continue to work on the quad sets for a week or 2 and then come back to try your straight leg raises. Exercise 3 is a hamstring curl. You're going to stand next to something that you could hold on to for balance, and you're going to bring your heel towards your buttock, hold for 2 seconds at the top, and then back down. The key is slow and controlled motion. If this gets easy, you can also progress with ankle weights. If this is more challenging in the standing position, you can lie down on your stomach and do the hamstring curl as well. The next exercise, exercise 4, is hip abduction. So again, you're going to stand, maybe you'll be at your kitchen counter, and you can hold nice and tall. You're going to bring your leg out to the side and back. So my toes are pointed forward. Think about leading with your heel. This is very important because this will help stabilize at your hips and will also help prevent having a limp after surgery. Exercise 5, hip adduction. So I'm going to stand in front of a counter at a railing and I'm going to bring my leg across my midline. Same progression as the others. If it seems easy, you can add an ankle weight. Think about using this muscle right here, that inner thigh. Another one that you'll be working on any place and any time of the day is ankle pumps. Just lifting up your toes and pointing away. This is very important to prevent clotting, and everyone is always very concerned with any kind of clotting after having a total knee replacement. So with this one, I would do 20 to 30 repetition intermittently throughout the day, watching TV, sitting at your desk chair. Whenever the mood strikes, get in some ankle pumps. Exercise 7 is heel slides. So you're going to lie on your back and you're going to bend your knee as far as you can. And at the top, you'll hold for 5 seconds and then you can relax. So now if you need a little assistance, you could use a strap or a dog leash. And as I come back, I'm giving a little extra pull. Hold for 5 seconds or 10 seconds, and then relax 10 to 15 times. Remember that getting your knee to bend after surgery is one of the most important things, secondary to extension. And so we want to make sure that we have as much as possible going into surgery. Exercise 8 is sit to stand. You're going to sit in a firm chair with your feet on the ground, touching the floor, and you're going to come up into standing. You're going to practice coming up without using your hands. Now, if you need your hands, that's okay, but you're going to work on progressing to not using your hands. So tip, you can push if you need to, and then maybe you'll progress to just using one hand and no hands. 10 to 15 repetition, just like before, 1 to 2 times a day. If it's too easy, you can add a third rep throughout your day. The next exercise is a single leg stance. So I'm going to stand right behind the chair that I was just using, and my hands are here if needed, but I'm going to lift up one leg and work on finding my balance on my opposite leg. My goal is 30 seconds without losing my balance. Pay attention to how much wobble you have. I would suggest that you do this on both legs because the other leg you'll be relying on after surgery. So try to do that for 3 times, each one holding for 30 seconds, and try that 1 to 2 times a day. So those are your core prehab exercises. You should print them out from the description below and then save that so you can check them off every day as you go through the list. Next, we're going to talk about cardiovascular fitness. Beyond these specific exercises, you need to do 20 to 30 minutes of cardiovascular daily. It could be walking. Even if there's a bit of pain, between 3 and 5 out of 10, you can use a stationary bike, and that will help maintain, possibly even improve your range of motion before surgery. A pool, if you have access, you could swim or walk laps. There's close to 0 impact on your knee, or an elliptical if you have access, and again, if it's tolerable. But your cardio fitness directly impacts your recovery. It will help your body tolerate anesthesia better. It increases blood flow, which your body needs to promote healing. It will leave you with more stamina for your rehabilitation afterwards. And it will also decrease your post-surgical complication risk. So do not skip this part. So while you're building up strength, let's get your home ready. This is a list of things that you're going to need when you get home after surgery. For your bathroom, a raised toilet seat. It's going to make sitting and standing a lot easier. Grab bars or a toilet safety frame, a shower chair, and a handheld shower head would really be very helpful. For your bedroom, you would like a firm chair with armrests. It's going to make getting dressed and putting on your shoes and socks much easier. A reacher or a grabber for that thing that just dropped that you need to go fish for, the sock or something that you possibly need to look for. A long-handled shoehorn and extra pillows. You'll be elevating your leg to help to decrease swelling. So in general, you'll also benefit from having a good cold pack or an ice machine for cryotherapy afterwards. Prepare and freeze meals ahead of time. Move items that you're going to need on a daily basis to your counter so you don't have to reach up in your kitchen cabinets and things like that, that they're all at level, possible coffee machine, things like that. Also, remove any slip hazards, such as a rug, or if you have an extension cord going across an area, those are going to become hazards. And then you'll also need either a walker or a cane or crutches, depending upon what level you're at the time that you're discharged from the hospital. Most people are discharged with a walker to home. Your surgeon's going to prescribe that for you. So let's talk about what to expect. I'm not going to sugarcoat it. Having a knee replacement and going through recovery is hard work. You're going to have pain, you're going to have limited mobility, you're going to have stiffness and swelling. The first 2 weeks are going to be the toughest. But I want you to remember that you're not alone, that you have your surgeon, you have your nurse, you have your physical therapist, you'll have videos and things like this that you'll be able to access. So you do have a team around you, and utilize that team as you need to. Remember that setbacks are normal and that your healing process isn't just linear, that you're going to have your up days and your down days, and that's just just very normal. That's how your body heals. So you want to stay active and keep pushing forward, because the more you move, the quicker and faster you're going to heal. Remember that the more you move now, even through discomfort, the more freedom that you will have later in movement and without pain. Before we wrap this up, I need you to contact your surgeon immediately if you experience any of these prior to your surgery. Number 1, signs of fever or infection. Number 2, new or worsening pain in your calf. Could be a blood clot. 3, if you have a skin infection anywhere on your body, open wounds near the surgical site. If you're having any dental problems or infections, they need to be treated prior to you having your knee surgery. If you have a sudden onset of severe knee pain, would be the next. And finally, if you have any illness such as cold or flu or COVID, tell your surgical team. These can delay your surgery or cause complications. So you want to address them now prior to surgery. All right, you now have everything you need for the next 8 weeks. Let's go through the checklist. Number 1, take your baseline measurements. Number 2, do your exercises 1 to 2 times a day. Number 3, 20 to 30 minutes of cardiovascular fitness every day. Number 4, prepare your home. Number 5, prepare mentally for the journey ahead. You are not passively just waiting for the surgery to happen. You are actively assisting in your recovery today. You are preparing to succeed. If you need more personalized guidance, I offer virtual physical therapy programs specifically for people that are preparing for and recovering from total knee replacements. So I have the link below if you'd like some more information. I'd love to work one-on-one with you on a customized plan. And don't forget, subscribe to the channel. I have 11 more videos coming out, all on the progression of total knee replacement recovery, as well as troubleshooting for the most common issues that people have after undergoing a total knee replacement. Drop a comment below. How far out from surgery are you? Are you nervous? Are you going into surgery? Are you excited about going into surgery? I read every comment and would love to hear from you. You've got this.